Imagine a condition so rare and debilitating that it gradually imprisons the body within a cage of its own making. This is not a scene from a science fiction movie, but a harsh reality for a small number of people around the world. This is the unfortunate reality faced by individuals living with Stoneman syndrome, scientifically known as fibrodysplasia ossificans progressiva, or FOP. This rare genetic disorder is not just a medical curiosity, it is a life-altering condition that affects every aspect of a person's existence. FOP is a genetic disorder characterized by the progressive ossification or bone formation in muscles, tendons, and ligaments. This means that over time, soft tissues in the body gradually turn into bone, leading to a second skeleton that severely restricts movement. This abnormal bone growth leads to the development of a second skeleton, severely restricting movement and causing significant disability. Everyday activities that most people take for granted, such as walking, eating, or even breathing, can become incredibly challenging for those with FOP. FOP is an extremely rare disease, affecting approximately 1 in 2 million people worldwide. Its rarity means that many medical professionals may never encounter a case in their careers, making diagnosis and treatment particularly challenging. The rarity of FOP makes it a challenge to diagnose and treat effectively. Often, the first signs of the disease are mistaken for other conditions, leading to delays in proper diagnosis and care. Early misdiagnosis can result in treatments that may inadvertently worsen the condition. There is currently no cure for FOP, and treatment focuses on managing symptoms and improving quality of life for patients. This often involves a multidisciplinary approach, including pain management, physical therapy, and sometimes surgical interventions to address complications. The impact of FOP extends beyond physical limitations. The emotional and psychological toll can be profound, as individuals and their families navigate the uncertainties and challenges posed by the disease. Coping with chronic pain, limited mobility, and the progressive nature of the condition requires immense strength and resilience. It can also take a toll on mental and emotional well-being, as individuals struggle to cope with chronic pain, limited mobility, and the progressive nature of the disease. Support from family, friends, and healthcare professionals is crucial in helping those affected maintain a positive outlook and quality of life. Despite these challenges, people with FOP display incredible resilience and determination, adapting to their circumstances and finding ways to live fulfilling lives. Many engage in advocacy and awareness efforts, sharing their stories to educate others and foster a sense of community. The journey of understanding and treating FOP is ongoing, with researchers around the world working tirelessly to unravel the complexities of this rare disease. Advances in genetic research and biotechnology hold promise for future breakthroughs that could transform the lives of those affected. Every new discovery brings us closer to finding effective treatments and ultimately, a cure for Stoneman syndrome. The hope is that one day, those living with FOP will no longer have to face the progressive loss of mobility and independence that currently defines their lives. Until then, it is crucial to raise awareness about FOP and support those affected by this life-altering condition. By fostering understanding and compassion, we can help improve the lives of those living with FOP and contribute to the ongoing search for a cure. At the heart of Stoneman syndrome lies a faulty gene, the ACVR1 gene. This gene is responsible for a variety of functions in the body, but its primary role is in the regulation of bone growth and development. It acts as a sort of genetic switch, turning on and off the processes that control how and where bone is formed. This gene plays a critical role in regulating bone growth and development. In a healthy individual, the ACVR1 gene ensures that bones grow in the right places and at the right times, maintaining a delicate balance that is essential for normal skeletal function. In individuals with FOP, a mutation in the ACVR1 gene disrupts this delicate balance, sending signals that cause the body to produce bone in places where it shouldn't, namely muscles, tendons, and ligaments. This aberrant bone formation can lead to severe restrictions in movement and significant physical disability over time. This genetic glitch turns the body's natural healing process against itself. Instead of repairing damaged tissue with scar tissue, the body mistakenly creates bone, leading to the progressive ossification of muscles and connective tissues. Normally, when we experience an injury like a muscle tear or a sprain, our body repairs the damage by forming scar tissue. This is a crucial part of the healing process, allowing the injured area to regain strength and function. However, in FOP, the mutated ACVR1 gene causes the body to overreact, producing bone instead of scar tissue during the healing process. This results in the gradual and irreversible transformation of soft tissues into bone, severely limiting mobility, and leading to a condition often described as being frozen in place. The inheritance pattern of FOP is autosomal dominant, meaning that a child only needs to inherit one copy of the mutated gene from one parent to develop the disorder. This pattern of inheritance significantly increases the likelihood of passing the condition to offspring if one parent is affected. In most cases, the mutation is not inherited but arises spontaneously. This spontaneous mutation can occur in any family regardless of their genetic history, making FOP a particularly unpredictable and challenging condition to manage. This means that even if neither parent has FOP, their child may still develop the condition due to a new mutation in the ACVR1 gene. This spontaneous mutation is a random event, highlighting the complexity and unpredictability of genetic disorders. Understanding the genetic underpinnings of FOP is crucial for developing effective treatments. By studying the ACVR1 gene and its mutations, researchers hope to uncover new ways to intervene in the disease process and prevent the formation of ectopic bone. Researchers are exploring various approaches, including gene therapy and drug development, to target the mutated ACVR1 gene and halt the progression of this debilitating disease. These efforts are aimed at not only improving the quality of life for those affected by FOP, but also at finding a potential cure for this rare and challenging condition. One of the earliest signs of FOP is often present at birth malformations of the big toes. These malformations are not just cosmetic issues, they are significant indicators of a deeper, underlying condition that will affect the child's life profoundly. These malformations can vary in severity, but often involve short, inwardly curved toes. Parents might notice that their child's toes look different from those of other children, prompting them to seek medical advice. While seemingly insignificant, this subtle clue can be a crucial indicator of FOP, especially when coupled with other symptoms that may arise later in life. Early diagnosis can be challenging, but recognizing these signs is the first step towards managing the condition. As the child grows, episodes of painful soft tissue swellings, known as flare-ups, begin to emerge. These flare-ups are not just painful, but can also be alarming for both the child and their parents. These flare-ups typically occur in muscles, tendons, and ligaments, often triggered by injuries, falls, or even viral illnesses. The body's response to these triggers is abnormal, leading to the formation of bone in places where it shouldn't be. Over time, these flare-ups lead to the formation of bony deposits, gradually restricting movement and causing joint stiffness. This progressive loss of mobility can significantly impact a child's ability to participate in everyday activities. The progression of FOP is unpredictable and varies from person to person. Some may experience long periods of stability, while others may face rapid changes that quickly alter their physical capabilities. Some individuals may experience slow progression with mild symptoms, allowing them to maintain a relatively normal lifestyle for many years, while others may face rapid and debilitating bone formation. This can lead to a significant reduction in their quality of life, requiring the use of mobility aids and constant medical care. As the disease advances, the extraskeletal bone can fuse joints, locking them in place and severely limiting mobility. This fusion can make even the simplest movements, like bending an arm or turning a head, incredibly difficult. The impact of FOP extends beyond physical limitations, affecting daily activities such as eating, speaking, and breathing. Tasks that most people take for granted become significant challenges for those with FOP. The formation of bone around the ribcage can restrict lung expansion, leading to respiratory difficulties. This can make breathing laborious and increase the risk of respiratory infections. Similarly, bone growth in the jaw can make it challenging to open the mouth wide enough to eat or speak clearly. This can affect nutrition and communication, further complicating the lives of those with FOP. Section 4. The Diagnostic Odyssey, Unveiling the Invisible. Diagnosing FOP is often a long and arduous journey. Its rarity and the fact that its early symptoms can mimic other more common conditions make it challenging to identify. Misdiagnosis is common, often leading to unnecessary and potentially harmful treatments. One of the key challenges in diagnosing FOP is that the initial symptoms, such as muscle pain and swelling, can be easily mistaken for other conditions like juvenile arthritis or sports injuries. This often leads to a delay in diagnosis, as doctors may initially pursue treatments for these more common ailments. Another hurdle in the diagnostic process is the lack of awareness about FOP among healthcare professionals. Because it is so rare, many doctors may not be familiar with the condition or its characteristic symptoms, further contributing to misdiagnosis. To accurately diagnose FOP, a combination of clinical evaluation, imaging studies, and genetic testing is often required. A thorough medical history, including a family history of FOP, is crucial. Imaging tests such as X-rays, Connecticut scans, and MRI scans can help visualize the characteristic bone formations associated with FOP. However, the gold standard for diagnosis is genetic testing, which can confirm the presence of the ACVR1 gene mutation. Section 5. Living with FOP, a constant battle.